Hello, everyone, and welcome to NYC Health and Hospitals Kings County YouTube podcast. In this season, we will be focusing on cardiology. My name is Bukharovich, and I'm Chief of Cardiology and Director of Hornreich Health Center. In this episode, we'll talk about the cardiology practice. I'm joined today by Dr. Stephen Hornreich, Ms. Taniesha Belvitt, nurse practitioner, and Ms. Viktoryia Perelman, a nurse practitioner in Hornreich Health Center. Today, we'll start our discussion by discussing the structure of cardiology department and what services we provide. Cardiology department at the Kings County provides a wide variety of services, from clinical preventive cardiology, consultation services, non-invasive cardiovascular imaging with nuclear stress testing, stress echocardiograms, TEs, heart failure management, both in hospital and in the outpatient setting, pediatric cardiology, and working on establishing the invasive cardiology section with electrophysiology and cardiac catheterization. I would like to ask Ms. Belvitt to give your input at what population that we usually see in our practice, what are the patients, and how we can help them.
Hello, Dr. Bukharovich. Kings County Hospital is located in the East Flatbush area of Brooklyn. We serve patients in the community as well as surrounding communities. Populations served are mostly Black and Hispanic, with a vast majority of patients from the Caribbean, South America, and African descent. The most common risk factors seen in the cardiology clinic are obesity, hypertension, diabetes, dyslipidemia, and smoking. Some of these risk factors might be primarily associated with lifestyle, like physical inactivity, high sodium diet, high cholesterol diet, and starchy diets. There are also those patients for which genetic plays a role in predisposing them to these risk factors for cardiovascular health issues.
Thank you, Ms. Belvitt, for this very detailed overview of our population. Now I would like to go to Ms. Perelman to discuss the diagnostic technologies that we have available to us to assess the cardiovascular health.
Thank you, Dr. Bukharovich, for this question. Some of the common procedures and technologies used in the field include electrocardiogram. This test records the electrical activity of the heart and can help diagnose various heart conditions such as arrhythmias, heart attacks, and other abnormalities. Echocardiography. These imaging techniques use sound waves to create a moving picture of the heart. It can assess the size, shape, and function of the heart, as well as the movement of the heart valves and blood flow. Stress testing involves monitoring the heart's activity while the patient exercises or is given medication to stimulate exercise. It can help diagnose coronary artery disease and evaluate the heart's response to physical stress. Holter monitoring involves wearing a portable EKG device that records the heart's electrical activity over a period of time, typically 24 to 48 hours. It can help diagnose irregular heart rhythms that may not be detected during the standard EKG. And also cardiac catheterization. Its invasive procedure involves inserting a catheter into the heart to obtain detailed information about the heart structure and function, as well as to perform treatments such as angioplasty or stent placement. These are just a few examples of the many diagnostic tools and technologies used by cardiovascular technologists to assess heart health. Each test provides valuable information that can aid in the diagnostic and treatment of cardiovascular conditions.
We're very happy to be joined today by Dr. Hornreich. He has multiple years of experience treating cardiac patients in different settings. So what would be your most common condition that you see in heart patients in our population, and what would be the approach to these patients?
Thank you for that question, Dr. Bukharovich. I've enjoyed my time up here in New York, greeted today by snow after 38 years in Florida. So we have diverse conditions that we see in the cardiology clinic and in the hospital. Foremost is a coronary artery disease, which is the blockage of the main arteries supplying the heart muscle. The heart muscle needs continuous blood supply because it's beating 24 hours a day for our entire life, up to 4 billion times in our entire life. If the arteries are blocked, we can get such symptoms as angina or chest pain, which pressure in the chest, which can radiate into the left arm or into the jaw or into the back. We can also see conditions such as heart failure, very common in the African American population, primarily due to undetected and unappreciated high blood pressure. High blood pressure for many years has been called the silent killer because many times people do not feel the high blood pressure. But the high blood pressure is like a weightlifter lifting heavy weights, which causes the heart to enlarge, thicken, but then eventually fail. So we now have excellent medications for treating this. We also see conditions that involve irregularities of heart rhythm, such as arrhythmias, is the technical term. Foremost is atrial fibrillation, which is an important issue to be caught. It's an irregular rhythm emanating from the top part of the heart. People sometimes can feel it and other times they can't, but it requires a medication to slow the heart rate down, because frequently it can be fast. Occasionally it can be slow, which would require a pacemaker, but most importantly it requires blood thinners, because the irregularity from the atrial fibrillation can cause clots, which can cause strokes, which is a blood clot going to the brain and very debilitating. We have all of the necessary equipment for evaluating these conditions at our disposal, which was mentioned by Viktoryia, one of our nurse practitioners here today, such as echocardiograms, the sound wave tests of the heart, the electrocardiograms, the Holter monitors, which could be 24 hours or up to 2 weeks. And we have the stress testing, where we can evaluate how well the heart responds to exertion and look at the blood flow indirectly. And then last but not least, cardiac catheterization, including coronary angiography, which is the injection of dye into the arteries to see where the blockages are. And frequently now we can open up these blockages with a small little balloon device and a stent or cage that keeps the arteries open and can help relieve symptomatology.
Thank you, Dr. Hornreich. There was an excellent overview of the patient population that we see. I just wanted to highlight some recent achievements in our cardiology practice. Both of our nuclear stress test laboratory and echocardiography laboratory received very prestigious Intersocietal Accreditation Commission designation that shows the standard of care that we deliver to our population. In addition, over the last 5 years, Department of Cardiology been recognized by American Heart Association with the Guidelines Gold Plus Award for treatment of heart failure patients, diabetes, and hypertension. And we're very proud of this achievement and standard of care that we deliver to the patients. Now we would like to discuss, in conclusion, what are the goals of Department of Cardiology and where is our care is heading and what advances we're looking at. Ms. Belvitt, would you like to address some of these issues?
Thank you, Dr. Bukharovich. The cardiology department has several goals when it comes to advancing care and improving patient outcomes. Some of these goals include early detection and prevention. Cardiology department aims to implement advanced screening and diagnostic tools to detect heart conditions at early stages, allowing for prompt intervention and better outcomes. Additionally, we are working to promote public awareness of heart disease, risk factors, and preventative measures. We also have personalized medicine. Cardiology departments seek to tailor treatment to individual patient based on their unique genetic, environmental, and lifestyle factors. This may involve the use of precision medicine techniques and genetic testing to identify the most effective treatment for each patient. Goal number 3 is enhanced patient care and experience. Improving our patient care and experience is a key goal in the cardiology department. This may involve implementing patient-centered care modules, providing comprehensive support services, and optimizing the patient's journey through the healthcare system. Our fourth goal is education and training. Our cardiology department is committed to continuing education and training of healthcare professionals to ensure that they are equipped with the latest knowledge and skills in the field. By pursuing these goals, cardiology department can contribute to advancing the field of cardiology, improving patient outcomes, and ultimately saving lives.
Thank you, Dr. Hornreich, Ms. Belvitt, and Ms. Perelman for joining me on this YouTube podcast. We're very happy to discuss the cardiology practice, the services that we offer, and hopefully we gave some very good information to our listeners. If they have any questions, they can always reach out to us and we'll be happy to answer them. Thank you.